Welcome to the Mount Pilgrim Missionary Baptist Church Network, where we are building faith and transforming lives, where our senior pastor is the Reverend James I. Perkins.
Well, good afternoon, and what a good afternoon it is. The wind is blowing a little, but the sun is out, and it's about 61 degree, my kind of weather. So we're just thankful to be here. I have with my guest today, and I'm thankful for his return, Dr. Lowery.
Well, good afternoon.
Thank you so much
Yes,
for,
sir.
for returning. And when you come or when you return, it's always good news, and it's always something that we are
Correct.
looking for some answers for. So I'm just so thankful that you're here with us. I'm so thankful that we have you in our community. I'm so thankful that you're at the hospital. I'm so thankful that you're here.
Well,
So
thank you.
it's just good to be
Yes,
with
sir.
you. And I know that you've been busy, and it looks like that things are sort of, I won't say calm, well, they are calming down just a little, but we're still concerned about the vaccinations, and we are still here at church and several of our churches. Matter of fact, Doctor, we just had a meeting today with Tom McQuarrie,
Mm-hmm.
talking about the vaccine and the vaccination, and we're trying to set up something that where we can bring the vaccination to the people rather than the people going there.
Mm-hmm.
And I'm hoping that this will be added to that conversation that Mr. McCreary and I had.
Mm-hmm.
So we just want to talk a little bit about the vaccination. I know that the age limit probably has been lifted.
Mm-hmm.
It's now with 16 or 17, but
Mm-hmm.
I'm not going to guess. I just want you just to speak to us about the vaccination and the vaccine. And
Sure. I'm happy to. The vaccine, there are three vaccines
Yeah.
that have been approved for use in the United States, and most people are familiar with the Pfizer vaccine and the Moderna vaccine.
Yeah.
The Johnson & Johnson vaccine is the one that's been in the news
Yeah.
lately, and it's not being given currently. But the vaccines have been very successful,
Yes.
and many vaccines for respiratory illnesses like the flu, if they prevent 65 or 70% of the cases,
Yeah.
that's considered very successful. And Moderna and Pfizer vaccine, it's felt that they prevent 95% or more of the cases of COVID. And currently in Caldwell County, there have been a little over 25,000 doses administered, either both doses of Pfizer or Moderna,
Yeah.
some Johnson & Johnson, or the initial dose of Pfizer and Moderna. But that's a very good number of vaccines, not nearly as high as we'd like to see.
Right.
But in the population of those age 65 or greater, statewide, about 70% or higher of those individuals have gotten vaccines.
You think that 60% is people that are just reluctant to take it, or they're just not know where to go to get it? Or I know you said it's about 40%. Did you say 40% of the population that has
About
received?
40% of the population, close to 50%
Yeah.
nationwide
Yeah.
of the adult population has gotten the
Okay.
vaccine so far. But there was some data in North Carolina about a week ago asking adults who could get the vaccine
Yeah.
who have not received it if they would be getting it. And about a third of those people said no.
Okay.
And the question is, why is that? Some of it's probably due to just not knowing where to go, but
Yeah.
a lot of it is due to fear, uncertainty, a variety of reasons. I'm afraid of complications. I don't know if there are any long-term side effects.
Yeah.
But one thing in these surveys that's cropped up are people who say, I don't think I'm going to get COVID, so I don't need a vaccine.
Yeah. Yeah. Has the side effects added to patients in the hospital, or has the hospital attended or addressed some of these issues with people? Has it been that severe that they had to see a doctor or to the hospital?
No, I know that some people have had side effects,
Yeah.
some haven't. I received both doses of the Pfizer
Yeah.
vaccine. My arm was a little sore after the second dose,
Yeah.
but that's the only side effect I had. I don't know of anyone who has been admitted to the
Okay.
hospital based on side effects, although things like sore muscles, achiness, headache,
Yeah.
low-grade fevers are common
Yeah.
side effects for a day or so after vaccine.
Well, my hesitant wasn't because of the COVID. It's just that I'm terrified of needles. I am, when you talk about
Right.
needles, it just ruins my day. Now, when I got the first one, and I was so lucky that when I entered in the facility there to get the shot, there was a lady there that our exercise with, or not with, but she attends the Quest on a day.
Right.
And we talking, just so happened, I just happened to get her booth where she was at. I said, now you know that I'm a coward. And I just went on and on. And after I continued talking, she had already administered the shot.
Right.
And she said, what are you afraid of? I said, I'm just afraid of that needle you about to put in my arm. She said, what needle I'm about to put in you? I've already put the needle in your arm.
I had the same experience. I told the person to let me know when they were ready to stick me with the needle, and they said, well, we're already done.
Yeah.
So I thought it hurt very little and
Yeah.
much less than the flu shot.
Yeah. Well, now, are these same places set up still, the Robins and hospitals and different places that are still operating?
We at Caldwell, we still have a vaccine clinic that's very busy.
Yeah,
And
I'm
it's
sure.
across the street from the hospital in
Yeah.
Robbins
Yeah.
Medical Park. And then the Caldwell County Health Department is
Yeah.
administering vaccines as
Mhm.
well. And those places are still all in the same location and intact.
I know that you guys communicate well with the health department and Robin's Nest.
Mhm.
Are they really giving the shots? Or are they having any difficulty in getting the vaccination? Or
No difficulty in getting the vaccination. The state has done a good job in allocating the
Yeah.
vaccine supply. And to be honest, what we're starting to have is a shortage of patients.
Yeah.
So when the vaccine first came out and as higher risk groups became eligible,
Yeah.
people were taking advantage of it. Now that all adults are approved, especially younger adults, we're
Yeah.
having fewer people show
Yeah.
up to be vaccinated.
Now, the younger adults, is it required to have adult or parent consent? Or what is the age that a young person?
Well, 18 would be someone could act on their own behalf unless they're
Yeah.
an emancipated minor at age 18. And one of the things to consider for younger people, I've heard people say, well, I'm young, even if I get COVID, it won't affect me that much. And
Yeah.
the truth is there are young people who have even died from COVID infections. But I like to think of the vaccine as protecting your friends and loved ones
yeah.
from you.
Oh,
So what I mean by that, if I'm vaccinated, it will help prevent me from getting sick. But if I get sick with COVID, I could spread it to those who are around me.
Yeah.
So, I think the only thing worse than getting COVID and having severe complications from that would be knowing that I gave an infection
Yeah.
to one of my friends or loved ones or coworkers. And so being vaccinated prevents that from happening.
One of the arguments that the people that refuse to take the shot is that when I speak to them, they'll see me with a mask on.
Mm-hmm.
Well, you've had both your shots.
Mm-hmm.
Then why are you still wearing a mask if you've had both of your shots? And that shot is effective as people say it is. And I just need some help in debating that with them.
Yeah. So a couple reasons for that. A vaccine gives you really good immunity. We think well over 90%, but not perfect immunity.
Right.
So we've started seeing plenty of patients who've been fully vaccinated who go on to get a COVID infection.
Mm-hmm.
So even if it's 95% effective, that means 5 out of 100 people can still possibly get infected.
Yeah.
So would you jump out of an airplane with a parachute if they told you, well, there's a 95% chance this is going to open, but there's a 5% chance it won't.
Yeah.
So I like to think of it in that way. Also, it's possible when you're vaccinated to still get an infection but be asymptomatic.
Okay.
The vaccine can make you not have symptoms, but you can still be infectious
Mm-hmm.
to others. And then thirdly, there are variants of the virus out there in increasing frequency, and at least one of the variants is felt to be somewhat resistant to the vaccine.
Uh-huh.
So to some degree, so there's still at this point a need to protect oneself and others,
Mm-hmm.
even if you've been fully vaccinated. Plus, fourthly, it's such a good example for those who haven't been vaccinated. It's kind of a visual reminder, like, hey guys, we need to still wear our masks.
Yeah. Is it possible for me to have the COVID virus and not really know that I got it until we go to check? Or what would be some of the symptoms? Well, I wouldn't be looking. People cough and everybody start looking, or I do. So I'm wondering, that's why I wanted that question. Is it possible for me to have it and not know that I got it?
It is, and that's one of the frustrating things about this disease is that some people get an infection and are so sick that they end up in the intensive care unit and die.
Yeah.
And some people get the infection and have absolutely no symptoms.
Yeah.
Yet those who have no symptoms at all are still contagious and can still spread it to others.
Mm-hmm.
So that's why some states or other countries have said you have to have a COVID test before you can enter our state or our country, because of those asymptomatic infections. Most hospitals that do surgery have been screening patients prior to surgery for asymptomatic infections, and the number of asymptomatic infections is relatively high.
Would it be a lingering infection even after you've spent your, 14 days or 30 days in quarantine? Is it possible to have a lingering, virus or lingering?
No, not in the sense that you still have an active infection. It's pretty clear once you're infected, after 10 days to 2 weeks, you're done being infected.
Yeah.
But the process but that infection can cause some damage to your body that can take quite a bit of time to get over.
Yeah.
For example, people with asthma can have their bronchial tubes, they can flare up and get inflamed, and even though the infection's gone, it can take time for that inflammation to go away. Or people have had chronic fatigue, like where they just feel wiped out and tired all the time after a COVID infection, and that can take a long time to get better.
Now, with the inflation and with the tiredness and weakness, is there any medication prescribed for that after knowing that you were COVID?
Well, there's a lot of research being done, and there's so many different, complications, long-lasting effects from COVID, and again, it's such an unusual disease in that there's a wide range of effects, and some people have an infection and have no complications or consequences, and they heal up just fine. Other people can take months and months for their taste or their smell to come back. Um, there other patients who have, fatigue or
Yeah.
some neurologic symptoms for weeks afterwards. And there's not any one medicine or any one treatment. All those are things that are being
Mhm.
researched. Usually time is the cure.
Yeah, yeah. So what I'm gonna say, just be patient and just wait for the virus to run its course
That's right.
with the proper medication
Mhm.
there. And the Johnson and Johnson, it had said that it was taken off. Well, not said it was,
Mhm.
and a lot of people now, they were a little hesitant with the Johnson and Johnson, but maybe more so now that it was taken off the shelves or was not being administered. What now, doctor, and you may not can answer it, that has improved? What makes it better now than what it was as the cause of it being taken off?
Well, the Pfizer and Moderna vaccine are made by a newer technique using what's called messenger RNA,
Mm-hmm.
and they've, people get headaches or achy muscles, but there haven't been serious, at least obvious serious pattern of a specific serious side effect
Yeah.
of those. The Johnson and Johnson vaccine was made in the traditional way the other vaccines have been made. To put in perspective, there were nearly 7 million doses of the Johnson and Johnson vaccine given, but there were 6 cases identified of an unusual blood clot that formed in a vein
Okay.
in the brain in 6 women. And one of those women died, which is a tragedy. But because this was identified, the same illness, the same event in 6 individuals after the vaccine, that's why administration was placed on hold. Now, again, remember there were nearly 7 million doses given, so this was a very, very, very rare event. But it was wise to stop it and evaluate.
Okay, very good. I know our time is out, but I got just one more. As in speaking, I've heard people say that once you get a quantity of the vaccine, whether it be Moderna or whatever, then it must be used. You can't store it back. But I'm thinking, well, is that just for the clinics or because the hospitals can't serve everybody in one day? Somewhere they're holding it, and
Well, so the vaccine comes in little vials,
Yeah.
and each vial you can usually get about 6 doses out of each vial, 5, 6, 7 doses out of each vial. Once that vial's open, you have to use
I
it.
see. Yeah, yeah,
But the unopened vials
Yeah.
can be stored for a fairly long period of time, as long as you have a deep freezer that can
yeah.
reach and we have an industrial freezer
Yeah.
that can store the vials at that temperature.
That answers a simple question. It we're referring to the vials and not the entire quantity
Correct.
of the shipment. That's
Correct.
where I think
Now
I
you can't store that unopened quantity for years and
Right.
years.
Yeah,
There's a
yeah,
shelf
yeah,
life, but
yeah,
it's
yeah.
it's
Okay.
long enough.
All right. Well, listen, unfortunately, our time is up, and I know you still got a busy schedule,
yes.
and I just thank you guys. Deborah, thank you so much for pulling him away and bringing him here. And Dr. Lowery, thank
Yes,
you
sir.
for
It's good to be here.
all of the wisdom and knowledge that you share with us. And I feel a little more smarter. I don't think that I can fill your shoes yet, but I think I'm a little more smarter.
I couldn't feel yours. I'm not a good preacher.
But thank you again, and thank all of you for listening in, and I hope that everything that we shared here today and all the information that Dr. Larry shared, that it will help you and it will sort of ease our minds a little about it's safe to take the shot, and we encourage everybody to take the shot. And I've said this before, if not for you, but for your family members or for your co-workers or just somebody at Walmart, you never know. So we encourage you to take the shot. It is available. You can go to, I was going to say Robin's Nest, but it's not Robin's Nest. It's Robin's Medical Park, or either at the hospital. So there are plenty of places that you can go and get the shot. So we encourage you. So again, Dr. Lowery, thank you.
Thank
Deborah,
you.
thank you.
Thank you.
And thank all of you for listening in, and I hope we've been a help to you. Have a good evening.
Thank you for tuning into another exciting segment of Straight Talk, where we get straight to the questions and answers that you would like to ask some of the leading people in Caldwell County. We look forward to bringing you podcasts that make an impact in our communities. So tune in every Thursday at 7 o'clock, where we will bring you Straight Talk. We want to keep you informed on activities that are going on within our communities. Be blessed. We will see you next week.